right, well, hi guys. Thank you for joining. My name's Kaylee, and I'll be hosting the webinar today. It's called How to Advocate for Yourself in Healthcare, Clearly Communicate Chronic Pain, Symptoms, and Functional Limitations. Before we start, I just want to thank you guys for being here, and a special thank you to everyone who stuck with us through the time change. We appreciate the flexibility, and we're excited to spend this time with you. Today's webinar is presented by the nonprofit that I started called Bridging Illness to Income. It is a nonprofit organization dedicated to helping individuals with chronic illness build sustainable income and long-term financial stability. Our mission is to help remove the financial barriers that health disruptions can create, allowing people to continue working, growing, and pursuing meaningful careers without having to sacrifice their well-being. Because living with chronic illness comes with challenges that many people never see, including medical expenses, missed work, reduced hours, financial uncertainty, and the difficulty of navigating healthcare systems that don't always make it easy to be heard. So through education, support programs, partnerships, and future initiatives, we're working to help bridge that gap. Today's webinar is part of that mission. We believe education can create opportunities, improve outcomes, build confidence, and help people advocate for the support and care that they deserve. We're also excited to share that this is just the beginning. We are actively developing additional webinars, educational resources, and programs for our community. So be sure to stay connected with us for future events and opportunities. And then just a few things before we get started. Everyone will remain muted during the presentation. If you have any questions for Karissa, please feel free to drop them in the chat throughout the webinar, and we'll do our best to answer as many as possible at the end if time allows, or if she asks if you have questions throughout the webinar. Of course, you can turn your mic on and go ahead and ask her. Before we get started, just take a minute to get comfortable, grab a drink, a snack, a notebook, a pen if you want to take notes, and just settle somewhere where you feel relaxed. This next 30 minutes to about an hour is for you, so we hope you leave with practical tools and encouragement you can use moving forward. Now it's my pleasure to introduce Karissa. Karissa is the creator behind Chronically Karissa, a platform dedicated to helping people with chronic illness better navigate healthcare, communicate with providers, and advocate for themselves with confidence. Prior to becoming a chronic illness advocate, Karissa worked in technology product management, and after developing complex neurological and autonomic health conditions, she experienced firsthand how difficult it can be to communicate symptoms, explain limitations, and receive appropriate care within the health system. Since then, she has become a trusted voice in the chronic illness community, sharing practical strategies that help patients prepare for appointments, organize their symptoms, communicate efficiently with healthcare providers, and navigate difficult medical conversations. So today, Karissa will be sharing actionable tips for clearly communicating chronic pain symptoms and functional limitations, helping you feel more prepared, confident, and empowered during medical appointments and healthcare interactions. We're incredibly grateful that she's taking the time to be here with us today and share both her expertise and lived experience. So please welcome Karissa. Give her 1 second to turn on the mic and
Hello, everyone. Hi.
hi.
Sorry, I got kicked out of there for a second, but
Oh, oh
thank you for
no.
the
Of
introduction.
course.
All right, I'm going to grab the screen here. All right, so hello, everyone. Um, I am Karissa over on Instagram and on social media. I'm Chronically Karissa. Um, And I figured I'll just tell you a little bit about me and how I came to be in this space. So, a little over 3 years ago, about 3.5 years ago, I had a lumbar puncture that changed my life. I had been having chronic pain and a lot of issues, had some neurological things going on, so they ordered a lumbar puncture. And after that, I was bedbound 22 to 24 hours a day, and I've been at that since that happened. So a little over 3.5 years ago. I've been in a place of needing help and being the patient, and I just didn't know really where to start, right? Like with all of this. Before I became a patient, I used to work in the software industry and I worked with like healthcare software and everything. And I always thought I was all up to date on everything that goes on with with healthcare, and I knew all the ins and outs of it until I got sick. And then I'm like, wow, this is so overwhelming. And so from there, I think I spent I've spent the last 3 years trying to navigate like everyone else has with our healthcare system and the insurance system and Social Security and long-term disability and all of those things that we are all dealing with on top of being extremely sick. And it's so for me, that's kind of where I came to start sharing my story on social media. And before that, I really hadn't used social media much. I was one of those people that posted every 2 or 3 weeks, maybe at the most. And once I started sharing my story, I just found so many people, and my following grew so much that I'm like, okay, there's obviously so many people like myself in the same boat, and we're trying to navigate this healthcare system and find a way to, get the help we need while being sick and while navigating all of those other things that we just talked about. So I've spent that time kind of figuring out my own navigation approach, and from that, I've kind of developed a few things that I found helpful, and so that's kind of why I wanted to join Kaylee and get on here to help share some of this information that I have found helpful. And I'm really excited because as part of this, I created a new um, free guide that's going to be really helpful. I think it's like a one pager that you can take to your doctor's appointments with you, and it just really helps to kind of organize things. And it sounds simple, but once I walk through this, hopefully it'll make sense like why this helps so much more than just coming in with all of your thoughts and hopes and dreams in that 10 minutes. Um, yeah, so for this kind of what I wanted to go through this approach, it's kind of just like this is how I came up with my framework. It's just like uh, number one, it was my brain, and actually, I'll just apologize now if you find that I have a long pause or I'm looking at my notes. My brain just doesn't work the same way that it used to, and I retain about half a sentence at a time usually. So that was the first thing is like, I used to be someone that could go to the doctor and rattle off the last 10 years worth of my health in 5 minutes or something like that. And now that my brain has changed and dealing with the illness and all of that stress and everything that goes along with that, that's something that didn't work anymore for me. And that approach certainly didn't work when I went to doctor's appointments because as we'll find that we've probably all found we wait for 7 months, sometimes longer for these appointments, and we go in there with literally all of our hopes and dreams in that basket, and you know, we're like, okay, they're going to be the one that's going to fix us. And so that's overwhelming us with all of this emotion and and then of course they come in and they usually spend 5 minutes of that whole 10 minutes we get with them looking at the computer and not even looking at us. And so when I first started going to appointments and saw that that was happening, I would get so overwhelmed, and then emotion takes over, right? And you're on the spot right then, and you finally have your time with this clinician, but then your emotions all took over, and you forgot 95% of the things that you had planned to discuss during the visit, right? So that was the first thing that I think just for advocating for myself is don't don't rely only on your brain anymore, and you don't have to, like it's a very overwhelming experience to go to these appointments. And I don't know that the clinicians quite grasp how stressful it can be and how traumatic it can be for a patient to go through that. And so so being able to advocate for yourself starts with, understanding your limitations and understanding where you need help and where you need to take the emotion out of something to make sure that you're getting all of the information and all of the benefit from this appointment from with your doctor. So what I started to do, and part of what I'm putting together will include all of this, but it's just some of the ways that I've found of managing my information. Number one is just opening a note and putting it in your phone, writing your symptoms down or something that you found. Just keep a running note, and then the beauty of all of these AI tools that we have now is we can take our gibberish data that we put together for ourselves, and it can help us format it beautifully. So even if you just keep it that simple where you're writing 1 or 2 words down a day, for how you feel or what you're trying to track, that can add up over time, and it'll give you a lot of information to give to your doctor. The second part of that is, keeping everything out of your head. One of the things that you should really try to use if you're able to is the online health portals like MyChart or whatever your hospital system uses. It can be a huge benefit to utilize that even if you're able to before some of your appointments. What I find is helpful for me is once I've kind of organized everything and know what that appointment's for and what I'm hoping to get out of it is I'll try to organize my questions that I'm going to have for the doctor. And of course, there's no guarantee that they're going to look at it before your appointment, but sending it over gives them even that 5 minutes before they come into the room while they're looking up your case and your appointment to say, oh, okay, they already sent this over, so I can start thinking that way. So, using external tools essentially, whatever you find that works for you. But for me, I find that keeping track on my phone, I use one app that tracks like pacing and it can track symptoms and things like that. But with that, you also have to try not to overwhelm yourself because if you start looking at apps and start looking at everything that's out there, there's so much. So, if you find one or you have one that's working for you, that's great. And it's a great way to help track your information over time and keep it organized and especially like the app that I use, it's for Visible Health, which is a pacing tool, but it lets you track things daily, and then it actually gives you an export that you can generate with all of your information. So, like for me, I have POTS, so it'll check my heart rate, and I can show spikes over time for 3 or 4 months and show the different highs and lows that I've had with my heart rate or something like that. But, just utilizing those external tools so that you are not holding all of those outcomes that you're expecting or hoping for in the appointment in your head. I think that's number one is just get it out of your head and try to get it down on paper so that you can organize it and have it ready to go. So that was my number one thing is really just organization. Number two is the communication part of it, right? And this I think is where I found with my journey through this that I'm a horrible communicator and I thought I was a really good communicator, but I found through this process that I would go to the doctor and expect I guess I thought that they understood what I was going through more than they really do. And for the first year, I would go into appointments saying, "This is what's wrong with me," and expecting that they're going to have an instant diagnosis, right? And when that would happen, and when that would happen, and I didn't get the answer, or they're looking at me like, "I'm sorry, I don't know what's wrong with you," and that was another hard thing. It's just hearing, "I don't know," or "We're not finding anything wrong," but putting all of that into that 10 minutes on top of what you've already been worrying about and getting all of that stress, it just I found that to create a really poor communication environment for the appointments. And I would leave frustrated. My provider would probably leave pretty anxious because I usually cried through the entire appointment. Um, it really didn't accomplish much. So, um, for us, we're carrying a lot of PTSD from past appointments. We're carrying the stigma of not feeling believed or worried that we're not going to be believed. And, there's a lot of things that we're probably defensive about and don't even know it because of the situation we've been put in. And so, when you go to appointment, especially now when they don't even look at you most of the time, right? They're looking at their computer screen. Sometimes they don't even touch you during an appointment anymore. And it can really leave you feeling like you weren't heard and that your time wasn't valued, right? And so there's a lot of emotion in that. And on the other side of things, we know that providers are overscheduled and that they are not allowed to spend the time that they should with us because of all of the bureaucracy stuff. But so just understanding from their perspective that they want to help us, they just need to have all the information they can to do that. And so that communication piece, I think, is really big. And what I found is that as I took the emotion out of the appointments and started having things more organized and coming prepared with questions that I'd thought of it before, or, just kind of being able to get to the guts of the appointment without all the of other stuff that's involved in it. It created a much more collaborative environment for me and my clinician to be able to work on plans. And I think it helped them hear me better because I was more organized and able to actually articulate what I expected and what I was hoping to get out of the appointment. So the communication piece is really big. And I think most providers, some of them can come across kind of grizzly and and some of them they don't sound like they're being empathetic, but I've been shocked to find that mostly those end up being the ones that help the most sometimes. But just understanding that they want to communicate with you. They want you to tell them what's wrong. They want you to tell them what you've had happen before. What even if they sound like they're busy and they're rushing through things, it's not because they don't want to hear what you want to say. And I think communication is one of the biggest things with advocating for yourself and being able to um, actually get somewhere with your health care. So that's really been my big thing. We're carrying years and they're carrying 10 minutes. So that's kind of how I think of it with the communication. Um, so the next part is really just, kind of the heart of it. The advocacy is um and this really what I want to get with this is that if we go to a doctor and expect them to create our entire life plan for us and everything that we might be able to do to get symptom relief or relief from some of our conditions, we're going to be failed, right? That's not what they are able to do anymore. And especially with so much more information being out there now, thanks to social media, we're finding out about things that help and have helped other patients before they are. Because, as we know, our healthcare system and the science behind it and clinical studies, things like that, that moves extremely slowly. It's 20, 30 years for that kind of thing to happen. So part of the advocacy and having the most effective care plan that you can for yourself is going to be doing some of the doing the research for yourself and finding some alternative therapies or options that may work for you that are out there. And um, what that also means is that there could be some times where a doctor suggests something and you may have to say no to it. And I've had that happen a few times, and it's because of the research and because of what I've done up front. And like for instance, I once I understood that I have hypermobile Ehlers-Danlos syndrome, I joined some support groups, etc., on Facebook, and luckily I had read some of the posts and had seen regularly that steroid injections are not something that's recommended for people that are hypermobile. And so for me, I remembered that, and I went to a pain management doctor, and he had said the best thing that's going to help you is this epidural or sorry, nerve block, and it's going to go into your cervical spine here, and we're going to put the steroids in there. And I'm like, so I knew that I'd read that, so then I said, let me think about it. I'm going to go do a little more research, and found that it just doesn't seem like it was indicated. And even though the doctors may not know that, especially when you have something that's more rare or something that's just not familiar to their area, right? Like an interventional pain management, they may not understand all the ins and outs of some of these rare diseases. So they're looking at it from, this is what we've done before, this works for the majority of people. So, part of advocating for yourself is going to have to be learning about your disease and trying to understand what is truly best and what is worth the risk and what's not. And again, that comes back to also the communication with your doctor. Once I explained this to the pain management doctor and said that, this is the risk, that it's going to make all of my connective tissue more friable, and then I might end up with more CSF leaks, and that's not what we want, right? So just having that kind of information and being able to speak to your own condition is going to really help with advocating for yourself and just knowing that it's okay, that sometimes you might have to say no to treatments, and sometimes you may have to tell your doctor about something more than once. And I found that once I've explained it to a doctor and have said, like, this is what I found. Like, for instance, I do a kinetic physical therapy, and it took me a long time to get to doing that. And part of that was like, let's do aquatic therapy. So I did that, and my body handled it well. And then they're like, okay, well, we're going to graduate you to regular physical therapy. So I started that regular physical therapy, and I started having horrible pain flares all the time. And once I started kind of lining up the time, I figured out that it's the physical therapy. It was just too hard on my body. And so then, I know, at least for me, one of the fears I have is that if I say no, that they're going to say, well, you don't want to get better. You're not doing the treatments we're recommending, and we're not going to treat you anymore. That was always my fear, at least. And what I found is they're not going to do that if you say no, especially if you're trying and you're finding other things that work for you. So with like that kinetic physical therapy, I told my pain management doctor about it and kind of walked him through what it was, and he said it sounded like a great idea, and I've been doing it for 3 or 4 months now and have gotten so much further with that than I did in 2 years of physical therapy the regular way. So just having the information in your back pocket. And again, not in your memory. You're not going to have to keep it all in your memory, but just having the information about your condition and doing the research and finding the things that are out there to help you is going to be really the foundation of being able to advocate for yourself. And I really like this phrase. It was, you are the CEO of your healthcare team. And that's true. Like you live in your body 24 hours a day, you know it the best. And if there's a clinician that finds fault or gets defensive if you um, have a legitimate reason not to do a treatment, then that's probably not the right provider for you. So and that's kind of another thing about the advocacy is sometimes you're going to have providers that aren't the right provider for you. And it's okay to ask for a new provider. It's okay to get a second opinion. Um, you know, that's, I think, a thing that as patients we worry so much about offending the clinician. And that's never our goal. And I don't think that they would find you standing up and trying to feel your best as anything but you advocating for yourself. And if you find that that's not the situation, then that's when you really should probably consider if that's the right provider for you. And if you find that you're having trouble with that, there's always resources out there for patients to help you navigate that. There's ombudsman. I know sometimes we hear bad stories about, hospital advocating for the patient, if they take the sides of the doctor and things like that. And there's always exceptions to the rule, and we're always going to hear the worst case scenario, right? That's what's going to get spread. But from from the perspective of being able to be in control of your own health care and truly get the right help that you need. You just have to know that it's okay. It's okay that you may not agree with the clinician all the time, and it's okay if it's not a good fit to find a new clinician. Um, okay, so then the next part, documentation. So I don't know about everybody else, but I feel like I've become my own case study. In the last 3.5 years, I've probably gathered more data about myself than I did in the previous 20 years. And so I'm sure that you guys are probably a lot like me where you start documenting everything and sometimes it feels like too much. So I say this with a grain of salt that documentation beats memory because we know that we have brain fog and we know that we're not going to remember everything. But that also doesn't mean you want to spend your entire life documenting everything you do like you're a lab rat, right? So you have to find a happy medium, but having documentation is really what's going to help build the foundation of your framework to own your health data and own your information, kind of like if as you start documenting things, it's going to build up. And one of the tools that I'm working on that's coming a little bit further down is going to be using this documentation with ChatGPT to get some helpful information on how to put things together so that you can discuss it with your clinicians or what to look for and things like that. So I'm taking something that we can put in any form. Like I said, even if it's just keeping a note on your phone with 1 or 2 words per day, like okay today, or like I was a 9, even if it's documenting, and it doesn't even have to be every day. It could be once a week, whatever works for you, but just kind of the things that you don't want to forget. Just don't depend on your memory. Try to keep some things documented and then what I'm hoping to ways to organize all of that documentation so that it doesn't feel overwhelming. It's something that you can kind of set and forget, right? Like it should only take you a few minutes a day. It shouldn't take all day every day to be sick, even though we are sick, if that makes sense. Um, so, um, the other part about the documentation is that for me, I found that it's something that you really have to have as well, especially if you're dealing with things like disability, Social Security, or any sort of long-term disability things. Having documentation and being able to uh, you know, speak to your case really is important. So having that information there is just stuff um, that you want to have. And, I think the other piece of documenting is don't start making it something that feels like you have to prove to yourself that you're still sick. And that's where the documentation came in with a grain of salt, right? Because I know that in some parts of the journey that I've been on so far, you know, it sometimes you start to question your own symptoms and your own brain and what's happening with your body. And when that happens, then you start over tracking and you start obsessing about everything you're doing. And so, that's where I hesitated to put documentation in here because I don't ever want it to feel like it's a job, right? It's already enough of a job to be sick all the time. Collecting the data about ourselves isn't um, isn't something that we want to start obsessing about too much. Um, I think I'll pause here. I've been talking for a long time. I don't know if anyone has any questions or wants to talk and tell me anything about their own journey, or I'll give you a second here just in case.
I could have a question, I guess.
Hey, Kaylee.
Okay, so it's not exactly like my rheumatologist or someone like I have a great rheumatologist. I have no problem with her, but yesterday I was at the dentist
Hmm.
and they diagnosed, I don't know if diagnose is the word, but they said I have a cavity. And this dentist has previously filled a few cavities for me before,
Hmm.
and she's n not very nice. Like she
Oh,
is just rude and it really hurt me the other time she did it. And it's like they just went ahead and made an appointment for me to get it filled within like a week or two and didn't like ask me if I wanted to follow through with that or anything. And I kind of want to see like if there's someone else I should go to. Like, should I
yeah.
tell them that? I don't want them to be like even more mad at me if I do that. Like,
No.
I'm just kind of
Yeah.
scared to let them know. Like, I kind of want to go see someone else. Like, how
Yeah.
would you go about that?
That's a great example. So I went through kind of the same thing where I got it. Look, my dentist is nice, but the filling hurt really bad and it was scary. So what I did was first I asked them if they offer sedation or if they can do the gas for you, and just let them know that you're very sensitive. what I said is I just don't know that I can handle all of the vibration from the cavity anymore. It was just so painful the last time. And they were able to give me a referral to someone that did do like in dentistry with sedation. So yeah, that's a great example where don't you should definitely ask. You should never feel uncomfortable for a procedure, especially if you had it before, because then you'll start getting more anxious about it because you know that it hurt last time, and then it just makes everything feel worse. So I would definitely give them a call and just say, like last time this happened, it was so painful. Do you guys offer sedation? Because your insurance should cover it if it's something that you're not able to handle. But that's something they should be able to help you with for sure.
Yeah, okay. I'm just kind of scared because I don't want them to be like even meaner
Right.
if I go
Yeah.
somewhere else, you know.
No, yeah, and
I will do that.
it's really hard to I understand because it's hard to feel like you have a voice, especially when they like act like you're being annoying or you're an inconvenience to them. But just remember that it's your body and there's always another provider out there, and so
Yeah,
you shouldn't feel like you have to go through something to and actually my doctor, I told them I was doing this webinar, and she actually told me, she said, tell them not to be afraid to tell us if you need something different. Patients are
yeah,
always very afraid to ask for what they need. And I'm like, that's really great to hear. And I'm sure that not all clinicians feel that way, but I think a majority of them do, and they would love for you to be honest with them.
right. Okay, yeah, I'm gonna give them a call and see if they could numb me up a little bit more in
Yeah.
some type of way. It looks
Yeah.
like you got some questions in the chat.
Oh,
If you
okay.
guys want to ask her those without the mic, you feel free to do that as well. Or with the mic on, feel free, but you can go ahead and read those
Okay,
unless
let me
someone
see
wants to
here.
chat.
Here we
Are you
go.
seeing it?
I see him. I got him
Oh,
now. All right. All right. Hi, Rainbow. Yes. So yes, the oh wow, you've had a bunch of steroid injections. So she said that she had no idea the steroid injections weren't suitable. Um, Yeah, it's one of those things. It's like once you start putting things together in hindsight, right? It makes it a lot easier to be like, oh, this is why that didn't work, or oh, this makes sense of why this made it worse. But yeah, I actually was just watching something, interestingly, those steroid injections aren't even actually FDA approved to go into your spine. So once I heard that, I was like, okay, now I feel even more comfortable about declining that. But yeah, that's one of those things that it's like, I don't think a lot of the doctors know that. I don't think a lot of the radiologists are aware of that. Oh, I'm so sorry that okay, so here's your question. Um, all right. Cannot afford insurance. You accepted that you're not getting the care. In the 5 years, you've been in constant pain. You've been trying hard enough to make enough money to afford it. Do I have any advice or experience for someone with health insurance? Yes. Okay. So number one, I think I would say, do you know if you would qualify for anything? And if not, I think there's some resources to try to help you find low cost coverage, or you may qualify for coverage with grants, right? Because now that with the Affordable Care Act and everything, it's all income based. So if you and they're fairly high income thresholds for a lot of the assistance. So, um, I can send you there's actually like you can have people help you for free too. Like they don't charge for it. And I think you can find it through the ACA website if you just put it in there, the Affordable Care Act website. um, it should come up with some numbers in your area for people that you can call, and they'll walk you through to see if you, because it's not just for like Medicare and Medicaid. They'll look for any plans that you might qualify for and any grants, any assistance, any of the stipend kind of things that you have that you might qualify for. And then if that does not work, there are a lot of resources, especially for EDS. It's a little bit harder to find, but on the EDS website, they do have some resources for patients out there, and actually they are so friendly and so nice. If you reach out to them, they would be be able to help connect you with some people that may be able to help you find some care or find some options in your area. But they're really good about helping that. And I think that's true for like any rare condition that you have. If you find like an advocacy page or a nonprofit that's related to the condition you have, that's usually the fastest way to be able to connect to um, either clinicians that are out there that can treat in your area, resources that are out there. Sometimes they even have other patient forums or people that will work like volunteers for each state that will help you do all of that stuff through the foundation. So that would be my start for sure. Oh, I'm so sorry you're dealing with that. I know it's very hard. Um, yeah, and I'm sure just like a lot of us, you found out that you had EDS after a lot of stuff had already happened to you. And so now you're um, trying to kind of put things together backwards, right? Um, but yeah, that's definitely my number one place would be start with any nonprofit for whatever conditions you have. And speaking of that, that actually goes to my fifth point, this community piece of it, right? Is we live in the best time for being able to create a community with people that have similar things, um and I think that is probably the biggest piece that will help you if you find the right community for yourself. And that doesn't necessarily mean Facebook support groups, or it could just be people you follow on TikTok or Instagram and things like that. Because, for myself, I found that most of the Facebook support groups were really bumming me out. I didn't enjoy, I don't like places where if you share, like, oh, this happened to me and this is what they recommended, like 10 people say, I had that done and it didn't work and it's never going to work and you're going to be like that forever. And, it's like, I don't do well with that kind of environment. So, for me, finding a community felt a little more challenging, but just um, the way I started was really just Googling the words lumbar puncture plus ear pain plus this, and so all of these things came up, and then that's kind of how I found places on Instagram, and then once you get that into your social media, then lots of resources and other accounts that can be helpful come up. One of the biggest community pieces I found that helped me was once I did get all of my insurance stuff situated, I was finally able to get on Medicare, and Medicare covers an advocate service, and there's a few companies out there. The company I work with is called Solus Health, and they they bill Medicare. They give you a nurse care manager that's in your area, so they're even familiar with where you're trying to find care and everything. And they are wonderful. They help with anything you need help with. They will help you make appointments. They help deal with like my long-term disability. They help me get referrals to doctors that I need. They are kind of like it's like having a clone that's healthy and can do all the things that you needed to do each day. And I just found this a couple months ago, so it's only been a couple months for me that I've been using the service, but I'm singing it to the rooftops because everybody should know that, there are services like that that are covered. And Rainbow, like for you, there's depending on what state you're in, there's some 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 places like that that exist just through the counties or through the states that will help you get all of that kind of stuff set up. So looking for healthcare advocates, just kind of searching for that maybe in your area, or that might be a resource you could do. But you know trying to come up with a team and have a community, it's a challenge because most of us are homebound, right? And we're not out in the community much. We we're probably pretty good at finding other people like us, but finding people that can help us is a little bit harder. But yeah, the community piece of it for me is just really uh trying to get a team together that can help you, and however that looks. And like I said, what I'm putting together will have some of those resources in it that you can reach out to try to get some help with navigating all of this, because it's overwhelming. It's a lot for anybody. I can't even imagine. I feel like it used to be hard to deal with healthcare as a healthy person, and I understood Medicare and things like that from my job, but now as the patient and looking at it from the other side, I'm like, this is so overwhelming, and I have a lot of information. I can only imagine how overwhelming it could be for people that haven't been familiar with this and are just dropped into it. So always reach out, even if it's looking on Instagram or TikTok and finding someone like Kaylee or myself that have pages where we offer these types of services. That's a great way to create a community for yourself. And then so the last part of, kind of what I've build out and how I've come up with this. And I'm sorry if my screen starts shaking. My dog just came down and he's down by my phone stand. Okay, the last part. Nobody's coming to save you, but advocacy can be learned. Um, so, I think we all know that nobody's coming with a white horse to save us, but it can always get better. We can have a better quality of life, and we still deserve to have a better quality of life. We're not, you know, we shouldn't consider ourselves done and left over. And, I think one of the things I found for myself was just um feeling like I had to live my entire life as a patient, right? As a sick person. And what does that mean? And what does that look like for me? Because, before I was sick, I was someone who loved fashion, and, I consider my handbag collection my retirement fund. I traveled, I did all of these fun things, and I'm like, I find that as the years have gone on, now I'm in the third 3.5 years into it, that person becomes further and further away. And, I've found that in the last 6 months or so, as I've tried to be more intentional about saying, okay, every day doesn't have to be a fire drill, right? And I think part of that is our brains, a lot of us with chronic illnesses have a lot of nervous system dysregulation just from the stress that the illnesses have created on our bodies. And being in that fight or flight mode all the time is so stressful and so hard on your body. And it's really not something that's easy to get out of. But what's really helped me is understanding that when I wake up in the morning, I don't have to solve everything right now. And I think that's the piece that, as I've gotten further into the journey, having more patience and understanding that nothing's going to happen overnight is really, really kind of my new mantra. And being able to kind of understand that and live with that and be comfortable with that makes a huge difference in how your mind processes everything. It doesn't feel like once you kind of put all of these systems in place, you won't wake up feeling like, oh my gosh, I'm afraid I'm going to forget all of those things that I need to plan for that appointment that's in 5 months, but I have to do it right now or I'm going to forget. And, I think we all probably have brains that work like that at some point through these illnesses because it's so stressful. And, you know, a thing that is hard is, we're not the same every day. We're not, some days we feel okay, right? We feel okay. And on those days, we find that we forget how we felt when we felt at our worst because that's how our brains work. It forgets the pain so that you're not going to hide in a hole and never experience pain again. So, having all of this framework built around you will allow you to breathe and will allow you to feel like you're in the driver's seat for your own care and for your own health. And you'll y- we are probably the most resilient group of people in the world because we get up every day and do it again, right? And I as I've developed this in the last few months, I've just felt I've been able to feel the shift for myself and how that affects my mental health, being organized, feeling like I have have some processes in place and that I'm not falling behind on making appointments, or I'm not worried about appointments or, data for appointments. I'm not worried about all of this because I have these things in place so that when it's time for my appointment, I have what I need there and I can speak for myself and I can advocate. And and it's not always necessarily just for appointments too. It's just for being able to understand what you're dealing with and organize it and be able to find those other treatments or other things that might help, right? There's so many free resources out there for help, but because because of the amount of data that we get, it's harder to find that, especially when we're overwhelmed and we're looking for pain management or something like that. And then you get on TikTok and you're like, oh my gosh, it says this cream's gonna get rid of all my pain. I should try that. And then you're like, I should try this, I should try that. And it gets so overwhelming. But once you kind of get this in place, then things kind of start making more sense and you can see what might actually help you because you now have the tools that you need, right? You have the information about your illness, you have the information about what may hurt or help your illness, and or you have a place where you can run that by a whole group of people, right? Like I I my doctor recommended this treatment for me. Has anyone tried it? Then you can kind of weigh it. But by creating that framework and creating understanding where you can go for the information, that's really going to just let you be in charge of your care and your care plan, right? And it's more than just clinicians. It's going to be everything. It's going to be how you eat, what you want to eat, things like that, your diet, your supplements, all of those things. Once once you kind of have all of this stuff in a row, even all of that becomes a lot simpler to manage because again, you can you have the information in places where you can kind of see it easier and um especially the product that I'm working on that'll be in a couple months, but what's really going to be helpful, I think, for people is I'm working on an AI, basically a way that you can ask ChatGPT things, not diagnostic, not things like that, but just like, hey, what's out there about this that I put in last week about my EDS? Like, for instance, let's say the nerve block. Like, all right, we were looking at nerve blocks last week. Now, what else can you tell me about that? Where else do I need to look for information? What would be helpful for me to recommend instead? So I'm kind of creating a framework that'll allow you to do that and have that have that information about your conditions and about your own health data in that same place so that it can give you educated responses. And I know that's kind of a very vague definition, but that's all the further I've gotten with it. But it's going to be really cool. So hopefully you guys will give me a follow on Instagram and TikTok, and as I get closer, I'll share more about that. But anyway, this is kind of essentially the guide that I'd wish someone had given me when I first got sick, but what I've created and what have I found living through it has worked well. And the one pager that I'm going to share with you guys that Kaylee will be putting up on the webinar page. I've used that at my last three doctor's appointments just to see how the doctors liked it and everything. I wanted to make sure it had everything they wanted in there, and they all told me that they really loved it, and it was so helpful because it's so simple too. It's going to be like four things. You put all your medications here, your upcoming appointments here, your questions for the doctor here, and I already forget what the other quadrant was, but it's that simple and it makes it a lot easier to get through those really fast appointments and get the most out of them that you can. So I'm really excited to share that with you guys, and I hope it'll be helpful. And thank you for joining. I really appreciate it, and I hope that you guys found this helpful. Let me see if there's any more questions here. Oh, I think we're good. Oh, wait. I
Um,
see.
there's
Sorry.
one that you skipped over.
Oh,
It says
okay.
from Haley, do you have issues with your doctors not looking at all of your symptoms as a whole? I get referred to specialists, but all my symptoms tie together, even though they are not all the same parts of my body. How do you make sure they're taking everything into account, even if it's not their specialty?
Yes. Hi, Haley. Thank you for that question. That's really kind of where this one pager helps a lot too, and just having the data put together. So what I found is I think once you get to a certain level of specialist, you kind of have to narrow it down, right? Even if you know all the symptoms fit together and they're all parts of your body. For instance, my I'll just use my dysautonomia for an example, right? We know dysautonomia affects your GI system, your cardiac stuff, nervous system, all of those things. But then, like, when I go to the GI doctor, even though I know this all fits together and it probably is related to my POTS, I want to make sure that I'm focusing on the most important symptoms and kind of working your way down. You can kind of, as a general, say, like, I've been having these systemic issues, but I think when you get to like cardiologist or GI doctors, I don't know that they are going to look at everything together, but you can give it, this makes it a lot easier for them to see that. So, like, that's what the fourth quadrant is. It's what your symptoms are. So it's like the fourth area of the template, but it's just kind of putting those symptoms together. And the template kind of helps you organize them. So you're taking like your top symptoms over the last 2 or 3 months and kind of putting them there based on the type of visit you have, right? So like if you're seeing a GI doctor, even though you might be having nerve pain and tachycardia and all these other things, um, that you can say, okay, this all adds up to looking like it's a nervous system issue. You can say, these are what I experienced for the last 30 days, and these are the symptoms I had. But, you know, another thing that, to that point is having a really good PCP can be helpful in that situation because if you start with them and they look at everything as a whole, then you know someone's looking at that, right? So, what I found is with some of the larger hospital systems, you can find PCPs that are for chronic care patients, and they sometimes call it advanced primary care, or they'll call it chronic care, primary care, things like that. But if you look at whatever the hospital system or whatever the system you are seeing your PCP through, or where you see the majority of your doctors, a lot of times, especially with larger groups, that will exist. And that would be, I found that to be a huge help because not only is it someone that knows you're going to have multi-system issues, typically they also have a nurse that will help you coordinate care and help you with things like on a monthly basis. They'll give you a call and everything, and that's another thing that's covered by insurance. So when you find that they're not looking at everything, sometimes you kind of have to just look at like what the top things are and what you need them to resolve. But because I think that goes more for us trying to prove to ourselves like, okay, we figured this out already, but they're not going to look at it that way. Unfortunately, it, you really have to kind of go with what kind of doctor you're seeing, right? With the symptoms. You can kind of start with the most specific and narrow down if you get time, but again, that's where having them all on that sheet makes it easier for them too because you don't have to go over and spend half of your 10-minute visit talking about all your symptoms and feeling like you have to convince them. All right. Let me see yeah, let me see your message. Oh my gosh, I'm so sorry you've been dealing with this for so long. Oh, you go to the emergency room for the pain. Yes, the pain piece is probably the hardest part with chronic illness. And I think I naively thought when I got sick that when you went to pain management that's what they were for, is that they were going to help with the pain and they would help me, with medication for the pain. But then you find, nope, they just want to do injections and not actually help with that. So, one thing that I've struggled with, and I've been dealing with it this year. Back in March, I had a horrific flare, and I spent the first 3 days of it trying to decide if it was bad enough to go to the ER. Then, during that 3 days, I'm trying to decide if it's worth having to try to explain myself and, tell them all of the symptoms and hope they believe me. Um, and that's so by day three, when it had gotten, it still hadn't passed. And then I said, okay, well, you know what? I should be calling my pain management doctor and asking them what's our rescue plan, right? And that's something that if you have pain management, is an important thing to try to establish. if you can't do it with pain management, that's another thing that if you can get a good primary care physician that you feel like is understanding your condition and understanding what's going on, they can help you with a rescue plan for pain too, because really we shouldn't we know we don't shouldn't be going to the emergency room for pain, right? Emergency rooms is not where pain management should happen. It's sad that we end up there so much, and that's that's where it almost feels like it harms you more than helps you to have that information when you go to the ER, right? Because you're telling them everything you have about yourself, and they're sitting there saying, "Oh, they looked all this up online so they can figure out the best way to score some meds," right? Isn't that the worst? It's like it's very scary, and I think really it's kind of trying to find, if you can find a good PCP, it makes all the difference for all of this, for all of your care that you're seeing outside of that. And I know that's not always possible, but if you're not able to find a good PCP, then I would recommend calling the care management at your insurance company, and they can help you with some of that stuff too, because the insurance companies don't want you to go to the ER for pain. That's super expensive for them too, right? Like they don't want us to be there. They want to keep us out of the ER as well. So they sometimes have access to other clinics or other ways that you can get help. And another thing that I've found lately is I don't know if you guys have heard this popping up, but um, I've heard a lot of talk of trying to find palliative care doctors for chronic pain. And um, you know, logistically that makes sense, but I think that's going to be just as challenging as pain management, because I think they're limiting them on what their scope of practice is too, just like they're limiting everyone else and what they're able to prescribe anymore. And um, unfortunately, the pain management piece I think is going to get harder for us before it gets easier. But yeah, try to find someone that you can have that's able to help you with a rescue plan, and that way you don't have to try to explain all your symptoms at the ER if it's possible. And I'm so sorry, Rainbow, that you were there for 8 hours. Oh my gosh. And you had a UTI. Yeah. And I'm assuming that they didn't even treat you for that to begin with, and you had to go through a bunch of tests that you didn't need. Yeah, it's so scary. Um, it is. It's a scary place for us to have to go to the ER, just as complex patients in general, right? It's a scary place. So, if you can find ways to make sure that you don't end up there unless it's a true emergency, and have those plans in place, it'll help you. And really, it helps you kind of mentally too, just to know that if you do have a horrible flare, that you have a plan in place, right? I know for me, that was probably what was causing half of my flares, was that I would start getting so anxious that I was going to have a flare because it hurt so bad and I didn't have any medication to help with the pain. Um, so yeah, that's it's a challenge, and that one I think is going to be harder for us before it gets easier. But I hope that answer helped Haley with trying to explain everything to the doctors. All right. Well, do you guys have any other questions? Is there anything else? Is there um, anything that you would like to see, like as I'm working on these digital products, any recommendations? And you guys can always reach out to me if you think of anything, like on social media, because I'm hoping to find ways to put stuff together so other people don't have to, right? Like that's my goal. If I think of something and it can help, I want to put it out there so everybody can have it. So if you guys ever think of anything or have any questions, always feel free to reach out. And I hope you guys give me a follow if you're not already. And thank you so much for having me today.
Thank you so much. That was great. That was spot on and very helpful. I think it was very helpful to everyone who had questions as well. So thank you so much. We really appreciate you supporting the nonprofit in this way. Um, just before we wrap it up, I'd like to thank you guys for joining us, you in the audience. Thank you, Rainbow and Haley and others that were here earlier and people who are going to watch the replay as well. If you found the webinar helpful, you can support us by sharing our website with friends, family members, healthcare providers, employers, or anyone who may be needing help, like benefiting from our mission. Our website is www.bridgingillnesstoincome.com. And before you go, don't forget to follow us on Instagram at bridgingillnessincome.com, as well as Karissa, of course. And just thank you guys once again for being here. And we hope to see you at the future webinars. And I hope you guys have a wonderful day.